Hi, it's Dr. John Yim speaking. This recent newsletter was on supplement review, and I thought I'd do a short video and go into just a little bit more depth on this topic. So, if you have a lot of different products at home like I do, what you want to do is to go through your cupboards and your drawers, gather all your products up, and put them on a table or a counter, line them up. And what we're going to do first is have a look at the expiry dates. So, for example, this product here, my Complete Digestive Formula, on the label it says expiry date November 10th, 2022. So we know that this is good for quite a while yet. On the other hand, you might look at another product and you can see that, oh, it's been expired for over 2 years. So, unlike dairy products, which have an expiry date, and when those dairy products expire, the worry is bacteria can start growing in those products that are spoiled. So when it comes to a nutritional supplement, it's not as likely that that's going to happen. The main concern is potency. When a manufacturer has put an expiry date on the product, what they're doing is saying that if you use this product up before this expiry date, we can guarantee that what's on the label is going to be in the product that you're taking. So, for example, if you're taking a magnesium and it says 200 milligrams of magnesium citrate, once it's past the expiry date, the manufacturer cannot guarantee that it has that many milligrams of the magnesium because things break down over time. So if you're using a product therapeutically for a health purpose and you're told to take a certain number of milligrams of a product, if the product is expired, you're not sure exactly how many milligrams that you're taking. Now, on the other hand, if you're taking a product that's just for maintenance and it's not really being used therapeutically, then even if it's past the expiry date by a short while, there's absolutely no problem with continuing that product until it's used up. But if it's several years past expiry date, then for sure I would discard that product. Now, products that are manufactured in Canada, they'll have an expiry date. Products that are manufactured in the US, for example, my Mega Stress, on the bottom here, there's some numbers and letters. And a number of years ago, a patient brought a product back and said, I need to return and exchange a product that you sold me because it's past the expiry date. And the expiry date was August 2018, and we're in September of 2018 now. This product is a month expired. And I looked at the product, and knowing that this product was made in the US, I explained to the patient, I said, look on the bottom and you'll see DOM 9/2018. DOM stands for date of manufacture. So in the US, rather than having expiry dates, they put on the bottle the date the product was manufactured. So most products are good for at least 2 years after their date of manufacture, and they're guaranteed to hold their potency for that length of time. So I said, this product was manufactured in August of 2018. So that means once it's past August of 2020, then it's going to be expired. So you have a year and 11 months yet before this product is expired. And I'm sure that the rate that you're taking it, 1 capsule a day, you will be done this product in 2 months' time. So you're far and away from date of expiry. So be careful of that. If you're looking at products and some of them were made in the US, then make sure that the date of manufacturing is within the 2-year frame. The date of expiry on Canadian products, that's when, if it's past that date, it's no longer any good, okay? It's not the same potency as what's on the label. So that's the distinction. Now, what should you be taking? I like to look at my own diet, and I tell the same thing to my patients. Look for where are the weaknesses in your diet. So, for example, my wife loves her vegetables. She loves her salads. So she knows that she's getting a wide range of minerals in what she's eating on a daily basis. Me, not so much. I know that Health Canada says we should be aiming for 5 to 10 servings of fruits and vegetables every day. On a good day, I might get 5 to 10, but I don't always get that. So one of my maintenance products is the Greens First. The Greens First, as some of you know, has about 54 different high antioxidant and very nutritious fruits, vegetables, herbs, and whatnot. And for me, that's my insurance. When I take a scoop of my greens, I know that I'm getting all those phytonutrients that are in the foods that are in that product. Another thing that people might take for maintenance are probiotics. So if you're one of those people that love and consume fermented foods on a regular basis, then you may not need probiotics to the same degree as somebody who does not enjoy eating fermented foods, and that's not part of their diet. So when we're eating, especially, for example, sauerkraut, where we're using organic cabbage, and it's shredded cabbage, brine, and the cabbage has been fermented. There's a whole broad range of soil probiotics that are in that fermented food that may not even be in a probiotic. A good probiotic may have 10, 15 different strains of friendly bacteria that we know that are very important for our immune, digestive health, and whatnot, but it's still monoculture compared to when you're eating fermented foods. So monoculture means like if you're farming and you're growing one food like corn, and in the exclusion of everything else, then if something happens to your corn, then your crop fails, you're out of luck, right? Whereas in a farm that grows many, many different types of fruits and vegetables, if one crop is not doing very well that season, but you've got many other crops, then you're not going to go hungry. So with a probiotic, even though your product may have 10 to 15 different strains of friendly bacteria, that's still limited compared to the range of probiotics that are in fermented foods. So I like to do both. I like to try to eat some fermented foods, and I also take my probiotics because I know that I don't eat a whole bunch of different types of fermented foods. So again, for me, that's insurance. How many of you are eating fish liver? If you're not eating fish liver, then you're probably not getting a lot of vitamin D in your diet. Liver oils like cod liver, halibut liver. Years ago, people used to take those fish oils, and one of the main reasons was for vitamin D, but also vitamin A. When people take cod liver oil, halibut liver oil, those foods contain vitamin A and D. And we know that there are very few foods that contain vitamin D, and especially at this time of the year. And even in the summer, many people might not be getting much sun, enough to make adequate levels of vitamin D. So vitamin D could be a maintenance thing that you take. So that's why I say, look at your diet and see where are the strengths and weaknesses. If you're a vegetarian and you're concerned about whether you're getting enough protein from the legumes that you're eating, one of your maintenance supplements could be a protein powder, a pea protein or a hemp protein or a rice protein, just to ensure that you're getting enough quality protein in your diet. Dosing. How do you know how much of the different supplements to take? For vitamin D, I had a patient come in today, and he has not been taking any vitamin D ever. And I said, even medical doctors these days are promoting vitamin D. I think that, here we are in January, so we're into winter. If you've not been taking any vitamin D yet, I'd like you to go and get your serum vitamin D tested to see where you are when you're not taking any D at all. So that way we can see, are you low? Are you in the range? Where are you? And that way we can help you with the dosing. Another patient that I have, she went to the doctor and had her vitamin D tested because of her history of osteoporosis. And even though she was taking 1,000 international units of vitamin D, her blood test came back as being low in vitamin D. So that told her that 1,000 international units was not enough for her needs. I said, for you, we're going to up that to 4,000. And 3 months from now, we will retest your vitamin D to see if that amount has brought you back into the normal range. So blood testing can test for things like iron stores, so your ferritin level can see whether you have adequate iron. You can get B12 tested through the blood to see, especially with the vegetarians and vegans, if your diet is providing enough B12. The vitamin D I mentioned already. And then with the minerals, you can do hair mineral analysis and see with your current diet, are you lacking in any of the vitamins, in any of the minerals? Sometimes people are taking minerals, and if their hair analysis comes back and they're low, that means that they're not absorbing the minerals that they're taking. So then we can appropriately dose their minerals based on what's showing up on their hair mineral analysis. So the other thing to consider is if there are certain conditions that you're treating, making sure that the supplements that you're taking has therapeutic doses of the nutrients that are supporting your condition. So a good example is that I've had patients come in to tell me that they've been taking glucosamine for their arthritis, and it doesn't do a thing for them. And then I'll ask, well, how many milligrams of glucosamine have you been taking? And the patient might say, the product is 500 milligrams of glucosamine per capsule, and I've been taking one a day for a year. It hasn't done a thing for my arthritis. And this may be a patient that's a 275-pound man. And I'll say, for your size and weight, 500 milligrams is a drop in the bucket. You're taking a supplement that's helpful for osteoarthritis, especially in helping to regenerate cartilage, but your dose is not even close. I said, for a person your size, you need to be taking 1,500 to 2,000 milligrams of the glucosamine a day. That means 3 to 4 a day is your dose. So you need to think about, are you getting therapeutic amounts of the different supplements that you may be taking, right? And then finally, something to think about is, are there conditions that you're trying to prevent? I have a patient that came in today that has a family history of Alzheimer's. And at 60 years old, he is worried. He's very apprehensive about coming down with this condition. And I said, with what we know today about Alzheimer's, Mediterranean diet, ketogenic diet, exercise, nutrients that improve circulation to the brain, and nutrients that help decrease inflammation anywhere in the body, but especially in the brain. These are some of the things that you can do to decrease your risk. Even if you carry the gene for Alzheimer's, your diet and your lifestyle can mitigate your genetics. So these are some of the things to think about if you're taking supplements also, is that, are there things that run in your family that you're trying to prevent? Things like diabetes, heart disease, cancer, dementia. Our diet, our lifestyle, and our supplement regime can decrease the risk of these different diseases. So with the supplement review, these are some of the things to think about when you're going through your cupboards and trying to decide what are the things that you need to take regularly and what are the things that you need to discard. So besides the things that are outdated, there may be things that you were taking years ago that are no longer a problem today. For example, I had a patient that had been taking things for reflux for many, many years. And I said to the patient, how long have you been taking this product? The patient said 10 years. And I said, when was the last time you had any reflux? And the patient said, I can't remember the last time I had any reflux. So I said, so why are you still taking this product? And the patient said, well, I thought maybe the reason that I didn't have the reflux anymore was because I've been continuing to take this product. And I said, that may be so, but let's think about it. Could it be any other reason? And I said, the main reason for reflux is that people are eating foods that are weakening the valve at the top of the stomach. Things like alcohol, coffee, rich fatty foods. He said, I worked on my diet when I was having the bad reflux, and I cut out those exact foods at the same time that I was taking the supplement for reflux. And he said, maybe it was a combination of stopping those aggravating foods and taking this reflux supplement that my reflux has gone away. I said, yes, what you need to do is experiment by going off of this product and see if you're not getting any reflux when you stop the product, then your lifestyle and diet changes that you made those years ago has helped resolve your reflux, and you probably no longer need this product. So you can keep it, and if you do have an aggravation of your reflux, take the product then. But if you, in the next 6 months, a year, whatever, while that product is not expired, you don't have any reflux, then if that product expires, just toss it out and feel confident that the diet changes that you've made has helped your problem and you don't need that product anymore. So again, check to see if there are products that you're taking maybe for recurrent bladder infections, before you reach menopause, or, like reflux medicine, or, things for irritable bowel, where with changes in diet and with probiotics, you no longer have irritable bowel. So those supplements that you were taking before, may not be a need for that anymore. So those are things that you can let go as well. So I hope this has been helpful for you, because I know it can be very overwhelming, when you look at the number of products that you've accumulated over the years, and you wonder, whether I should still be taking all these things, or can I start cutting back? So until next time, thank you for listening, and I hope this has been helpful.